Okay, I think we'll go ahead and get going. Andrew, I'll give you a second here.
We're good to go.
Okay. All right. Thanks, everybody, for joining us again for a virtual news conference. Actually, I should just say we're Zooming for a news conference. Virtual, we're actually having it, just to be clear. But this will be a weekly update that we'll do for the foreseeable future, as we did on Monday, just regarding the current circumstances regarding COVID-19, with updates from the city of Bloomington, Indiana University, Monroe County Health, Monroe County Emergency Management, and IU Health. Today we have a bit of a lighter crew responding to questions today because of schedules, but we do have Mayor John Hamilton. I will be speaking. I'm Chuck Carney, the Director of Media Relations for Indiana University and spokesperson. I'll be speaking on the Indiana University behalf. But let me first of all start with the mayor for some remarks about what is happening here on Friday, a few days since we had our first update on COVID-19 in Bloomington. And you may need to unmute yourself, John.
There we go. Can you hear me now?
Yes.
Very good. Thank you. This is John Hamilton. I appreciate all who are here, and Chuck and IU, thanks for the logistics of this. I appreciate on Friday the 27th here in the afternoon, giving an update. I think we don't have the health department available today. They will be, I know, again, and we have constant meetings going on, and they're probably doing some of that. You probably have seen we have 8 confirmed cases in Monroe County now. The health system is preparing for a surge that is expected as those cases are rising and continue to rise, and working closely with all of our partners on that. We are in the 3rd day of the official stay-at-home order that came from the governor, effective midnight Tuesday night into Wednesday, and that has been a substantial change in the state, and we appreciate that. I think that's been a good thing that's happened to try to step in early and create the physical distancing and the reductions in opportunity. We know the coronavirus is probably all across Indiana. We know it's in our county, and we don't have a lot of testing going on, so we're not as sure of how many and where, but we know it's here. And so this stay-at-home order, which says unless you're working for an essential business or doing an essential activity, you must stay home. That is a mandatory order over the next 2 weeks through early April, and it could be extended by the state. It could be extended locally, even if the state doesn't. And I think that effort to tamp down the spread of the virus is really important. We know it's going to get worse before it gets better here. We can see the previews in some ways of different parts of the world or different parts of our own country of some of the pressures that can come on a health system if we don't do this right. The continuity of city government continues. We have a group, they've now met 7 times in the last less than 2 weeks, really digging in a detailed way to make sure our city government essential services do continue. That group is changing a lot of protocols in what we do in city government while our people remain working, whether they're remote workers or whether they're frontline workers, to provide the essential services. And we're changing a lot of protocols, from dispatch to police to fire to parks to water services to the animal shelter and many others. You know, you've seen buildings closed. Playgrounds are now wrapped with yellow tape to indicate that's a place where a lot of virus can get transmitted. So we're doing a lot of things to adapt to that while we continue to provide these services that are so important. City Council met this week, Wednesday night, the first time that I expect in history they met remotely, as they did, all remotely, and took some important actions. They approved a bond refinancing. They're very low rates. We're going to save a couple $1 million by refinancing some water bonds. And they also, $2 million request was made to redirect food and beverage tax revenues into some economic stabilization and recovery efforts to help our small businesses and their employees get through these challenges. I know we continue to meet with, from the city side, with our county partners, IU Health, and other partners regularly to identify ways we can help each other where we see mutual challenges. And I'll just end my brief opening statement by making a report that last time we talked about the importance of integrating and aligning services outside the pure healthcare, the healthcare focused effort with the Department of Health and Penny Caudill, our Commissioner of Health, and Indiana University Health, which provides so many services for public health, are front and center in trying to protect us on the medical and health front. But we have some really important other challenges in parallel. One is what you might just call the safety net, the social services safety net. And a second is the whole economy and jobs and income that will help all of us get through this. And we set up work groups. I asked some folks to come together, and they have been hard at work. I actually got 2 major pieces of work delivered last night, and we'll be sharing those not in any detail yet. They're still in draft form, but the social services group, which is 5 philanthropic leaders, are coming together, trying to identify what are some key safety net components where we see stress, gaps, and real important interventions, and how do we bring the resources and align the efforts around those. They would be things like housing for populations and people at risk, and making sure that we've got a place for people to go if they need to isolate, if they need safe protection in that way. Another area would be food security, making sure with all these disruptions that we assure basic food necessities. And a third would be childcare, thinking about all of our essential workers, whether they're healthcare, public safety, dispatch, others, grocery store clerks, et cetera. How do we make sure they have the childcare needs met when we see so many childcare centers closing due to all the pressures and changes we're under? That group is going to be working hard to identify a plan to develop responses there in the short days ahead. And then a second group, economic stabilization and recovery, similar accumulation of some of the leadership locally to identify immediate steps that need to be taken, as well as some medium and long-term steps. And as many of you probably know, there was a first $300,000, $350,000 on the social service side that's going out the door in the next few days through round 1 of that. And I want to thank everybody who helped coordinate that. And then there'll be rounds 2.0 and 3.0 looking at how we keep that going. And on the economic side, both the county and the city have been asking to put some resources right on the street quite quickly to help folks deal with that. I spoke to City Council Wednesday night. One of the things I said is it's going to get worse before it gets better. We know we're at the front edge of this. Some call this a marathon, not a sprint. I think it is a marathon that starts with a sprint, and we're still in the sprint phase trying to get ready for things that we can expect to come. I appreciate everybody's diligence and attention to the stay-at-home order when you can. And I also appreciate the way this community is coming together to try to help deal with this in the most constructive and collaborative way we can. So, Chuck, I think I'll stop there, and then if there are other comments to be made, that's great, and then we can open up for questions as you direct.
Okay, thank you, Mr. Mayor. And I am monitoring the chat questions, and we'll get to those, and we're getting some coming in on Facebook as well. I'm gonna go to Penny Givens, Monroe County Commissioner, for some comments.
Thanks, Chuck, and it's really nice that you're putting this together so that we can stay in touch with the community. For the people that get the HT, the tent that was pictured on the front page today outside the hospital is from the county's emergency management group. We're really happy that we're able to do those kinds of things. Helps to keep our healthcare workers safer, hopefully, in many, many ways. On Tuesday, the Food and Beverage Tax Advisory Commission approved $200,000 of the food and beverage tax that is allocated to the county to be used to help support different groups economically. We will specifically be targeting people involved outside the Bloomington city limits who are involved in tourism, with especially focus on restaurants. We have an application up at the Monroe County website for people that are interested in applying for some support. And we've had that approved also by the county council. So we should be good to go. We'll start with looking over things this weekend because we do want to get things out there. We don't want people to be removed from their housing. We want to make sure that people have food, and we want to, like I said, support people as much as we can. We're also trying to push as hard as we can for complete response to the 2020 census. I know Mark Fig, who's on the call today, has been really critical to helping with, especially the IU students who are no longer in residence, who are apartment renters, but we need to make sure that we get as many people responding to that as possible. It's critical for funding over the next decade. It's also critical for representation at both the congressional and the state level for Monroe County. On Wednesday, the Secretary of State announced that there's going to be no excuse absentee ballots available for people. And so I've been in touch with the county clerk's office and asked them to put information up at their website as soon as possible. And we'll also be pushing that out as soon as we have that. The Secretary of State has to revise the absentee ballot request form so that that's available to people. The county's in the process of doing childcare needs survey for our essential employees, such as the county sheriff's deputies, the people in the health department itself, those that work in our jail system, and any others that we consider essential employees. I've also been part of the childcare group that's been talking, so that we are really aware of the needs that we have for these essential employees. That is going to be covering their children who are 0 to 5, who've been impacted by the shutdowns, as the mayor mentioned, of many of the child care centers, and then the school age kids, especially those 6 to 12. We need people at Catalent and Boston Scientific and Cook and others at work to help fight what's going on in this crisis. We've been having daily calls among people within the county, including Penny Cottle, our health director, and Allison Moore, our director of emergency management, trying to stay on top of things as much as possible. And the county very early on provided $25,000 to help with the food issues at the Hoosier Hills Food Bank. And we also provided $25,000 to the social service group that's being led by the United Way that the mayor also referenced. So we're trying to stay on top of things. Look forward to talking to people and hearing what those questions are. Thank you.
Thank you. And Brian Shockney joined us here on the call. Brian is the South Central Region President for IU Health. Brian, if you want to make some comments. May still be muted, Brian. Look like we're having a little technical glitch there. Now, I think you're back. Still not hearing you though.
How about that?
There you go.
Okay. So
we need everybody else to mute if you are not muted already.
Okay, there we go. Okay. Sounds like we still have an echo there. Is everyone muted?
Can you unmute now?
Okay, are we good now?
Not sure where that's coming from. If anybody sees that you are unmuted for some reason, go ahead and mute.
All right. Seems to be me. Okay, I'm gonna try to log in again.
Okay, I'll speak to the IU portion of this while you're doing that. So reflecting a bit of what was said earlier, we want to make sure, one of the things we're trying to emphasize, you may have seen that the provost, Lauren Robel, issued a statement to students earlier this week, a letter to students yesterday. And she made several points in there, among them being that classes this summer have moved to online. But the first point she made was simply about students who have been elsewhere, maybe returning to Bloomington. And we had, I know that the Bloomington Police Department had to respond to at least one gathering of 30 students around that earlier this week. So we are emphasizing to parents, for one, to emphasize to their students that if they do come back to Bloomington, they need to isolate just as everyone else, and they cannot continue to have these sort of gatherings. So something that colleges across the country, of course, are battling, and we're trying to make sure that that message gets through. The move in, or move out rather, for students at the IU residence halls has been halted as of the governor's order. That was supposed to start on Tuesday. That is halted at least through April 6th. And those were, to refresh your memory if you're not familiar, those were to be individual appointments for those who are in residence halls to move out the rest of their belongings by May 1st. So we're in the process of rescheduling some of those. We may have to reschedule further if, of course, the order does extend further as well. And campus is not closed, but essential personnel only working on campus at this time. And we are truly spreading everyone out. As you can tell, I am in my home office, and the Emergency Operations Center at IU Bloomington is operating with as few people in person as possible. They are actually located in Franklin Hall, which, as you probably know, is a large space, and they're spread out at least 6 feet apart, and as few people in person as are needed to be there. Most of us are working from remote locations in our own homes. And other than that, I'll be happy to answer other questions about IU that others may have. And Brian, I see you're back on. If you
I am. I think we're good.
Yeah.
So from a hospital standpoint, we continue to ramp up operations as we continue to see more and more positive tests, more and more inpatients coming into the hospital. Our search plans are in place. We have search plans with IU Health that connect with not only our local hospital here and our regional hospitals, but also with the state, all IU hospitals across the state. First of all, I'd like to say thank you for all the donations. We've had restaurants and vendors reach out to us on a regular basis, and they're bringing food to our employees. We've had to scale back our food, as you can imagine, our food choices, no salad bars, nothing that can be touched. And so the packaged items that we're able to provide to our employees, 2,000 employees that are here on the Bloomington campus, and across the state, 5,000, or across the region, 5,000. It was pretty slim, and it's the same thing. So it's been welcomed, and we appreciate that. We've also had a great deal of local quilters and people who are reaching out and sewing masks and donating those, and we appreciate that. All those donations are to go to our Miller Drive location. Carol Weiss Kennedy is taking all of those in, and we're not only distributing those to local not-for-profit organizations that care for different individuals, but also our healthcare facilities across the region, as well as here in the hospital and our clinics. So we appreciate that. And if you know of a group that quilts or wants to make make masks, we would certainly appreciate that. And they can get their patterns and information. We've got connections on the website, but also Carol Weiss Kennedy at our Miller Drive location can also provide support there. I guess the biggest thing is our testing. So last time we talked about 3 phases in testing, and the first phase was patients who would come to us, and we were using the Indiana State Department of Health testing site for all of our patients. And then last week about this time, we were standing up the IU Health in Indianapolis Central Lab, pathology lab, to be able to start testing our own patients and also testing our healthcare workers. That's been going on for a week. And now we are moving that to another site where it will be a drive-through site. As we see more and more people coming forward, more of our healthcare workers and more of our patients needing testing, we are doing a drive-through site at our landmark location that will be coming up next week. So the second phase is our patients that we care for here in our hospital. It will be our healthcare workers who we're seeing increased, they're community acquired at this point. And then we also then will be providing screening for all healthcare workers in this region, police and fire as well. So if they will go through our virtual hub, they'll dial into the virtual hub will screen them, and then they will direct them to this drive-through testing site, which will take, right now we're using the yellow tent that the county has been able to provide for us outside of our emergency room. And now that we know we'll be seeing a lot more, we need to move to a offsite location where we can take care of more people and do testing on more people. So that will be coming up the next week. So the tent will remain because that remains, and as Penny said, it provides us an opportunity to protect healthcare workers as people come to our emergency department and on our campus. But all of the testing that's referring from the hub and the healthcare workers and emergency workers in our communities, they will be forwarded to this new location at our landmark office. So wanted everyone to know that and to get the word out. I can't stress enough, as Chuck said, regarding congregating. Singapore is a good example of how they were able to avoid rampant disease and virus spread, how they really cracked down on people coming together in locations and practice good hand hygiene. And I just can't stress enough that need in our communities and in our families, that will definitely stop the spread of this virus. And when we find someone who's positive and we start doing the tracers and trace back who they've come in contact with and how it spread, it was because they did not practice good social distancing for the most part and hand hygiene. So if we can get the word out more and more on that, I think heightened awareness of that is going to be what is going to, as we talk about, flatten the curve here in our South Central region. And I'll stop there with my remarks and we can entertain questions.
Yeah, we have quite a few that have come in on chat and on Facebook. I want to get to the media questions first here. Question first, and this is for you, Brian, from Dave Askins with the B Square Beacon. Can you confirm the total number of beds at the hospital at 270? And can you confirm the hospital has the capacity to make all those rooms in those beds negative pressure environments? There's a second part to that, but let me stop there.
Yeah. So yes, we do have those beds, but we've also expanded our beds. So our sleep study unit is, we closed that unit, and that is now a capacity for beds. That's part of our surge capacity plan. We also have executed an agreement with Ivy Tech and their nursing school and their area there for patients who need to be discharged from our facility. So if you can't go home because someone has COVID at your house or they need to be quarantined, Ivy Tech has provided us their facilities so that we can take patients there and they would be discharged from our facility, but we can help them. We have our pharmacy, our community pharmacy up and running. We'll be able to give them their meds that they need and be able to take them there and help them stay there until they can get to another location. So that gives us capacity. We continue every day to bring more and more rooms up under negative pressure. And based on our projections, we believe we have what we need to be able to take care of those negative pressure rooms. So yes, we do have the 272, but we're actually expanding that beyond. Over the years, we've had different locations here in the hospital that we've turned into outpatient areas or surgical check-in and recovery areas. And now that we've gone to all only emergency surgeries, we've got all that space that now we've converted and can take patients in for our surge plan.
And the second part of that, which I think you partly answered, but this is looking for a numerical answer here. If more than 270 COVID-19 patients required hospitalization, what is the hospital's numerical capacity to add beds?
Yeah, from a number standpoint, I can't give you an exact number because we're still looking at all those different areas, but we will be up over 300 beds, and what we're projecting now will be what we need. Again, we're looking at every day, we're looking at what the potential could be based upon what others are seeing in other communities our size. You know, I think that here in our region, for example, we're seeing what's happening across the state. If you look at Paoli, we've seen very little positive testing there through the emergency department. And there's, you know, it's a more rural area, more spread out, less population density. And that's what we're seeing in all communities. And so we're trying to compare ourselves to other communities of like size.
And I think you said that the first strategy would be to add beds on site. That's the next question. Would that be the first strategy, or to recruit a facility like the convention center?
Yeah, so we have backup plans for external sites as well. We won't disclose where those are, but we have that plan. But we always will expand within our hospital first. And then because we are part of a system here at IU Health, and we have Bedford Hospital, Paoli Hospital, Morgan Hospital, we have the statewide hospitals as well. So we've got the capacity to move patients where we need them to be and open beds that may not have been utilized or not being utilized currently.
From Emily Ernsberger from the HT for Mayor Hamilton, is the city still issuing parking tickets during this time? And if so, why is parking enforcement still an essential service beyond telling people where they shouldn't park in front of hydrants, et cetera?
Thanks for the question. We are not generally issuing parking tickets. As you know, we made a kind of 2-hour free for everybody. And while we do monitor situations where there's, for example, parking in front of a hydrant where they may need to be towed, or if there's a car that's just abandoned or left for a long time, we may need to tow it. We are available to do that. Like many employees in the city government, the parking facility folks, parking personnel are being redeployed and reassigned to do some different things. I won't go into the detail on that, but one thing, when we have a lot of vacant areas or vacant apartments or lower population apartments, sometimes it's useful to have a presence there to be seen, just to help protect public safety. But they are not generally writing tickets. It's not generally been a problem that we've seen. If there are particular problems, residents or business owners can let us know and we can intercede in that. I can also note, I will just note the overall crime calls are down a little bit, which is a good thing too. And we're able to assign our people to help protect and provide services wherever we can.
Emily had another question. When will we hear what the farmers market will be like at the start of the upcoming season?
Thank you. Yes, the farmers market opens April 4th. I think that's the Saturday, and there will be information coming out quite soon in the next coming days about the plans for that market. As you might imagine, and those who follow the winter market, that's a privately run market. Their protocols have changed. I will tell you, I would expect that our protocols for the April market likely will change in light of the situation we're in, but we do treat the farmers market as a grocery store. It provides essential services and food to people. It also is an essential business for the food producers. And so we're working very hard to identify how we do that safely. I will also just note that the April market tends to be, it's a little bit different from the full summer market, which kicks in May, early May, and we'll be sharing information about both of those. But you should hear about those details in the next couple of days. The Parks Department is working diligently to try to nail down all the ways that should be done.
Thanks. And Emily has a question posed to me. Is there any modeling being done to estimate when in Indiana, Monroe County, the region may hit its peak? And the answer to that generally is yes. And our emergency management people have been, the county and the university are certainly looking at that. I would point you to a resource, and I can send you a direct link. There is at news.iu.edu a story on this under news at IUPUI. The O'Neill School, or I'm sorry, it's the School of Science at IUPUI, has been putting together data for statistical models for the COVID spread. The story we have up there is March 18th, so it's a few days old, but they have continued to look at this, and there is a link in that story to the latest research online and where that is. So that's a good resource for that. Emily also has a question for Brian. Given IU Health's position as a medical hub in the region, how is IU Health Bloomington working with county health officials and other partners to share information about COVID-19 patients that physically may be in Monroe County, but are residents elsewhere?
Yeah, so the good thing about Monroe County that we don't see in a lot of counties around the state of Indiana is the partnership that's been over 20 years in the making. So the county contracts with the hospital for the provision of nursing care. And so Amy Meek, who is our manager for that, she also is an employee of IU Health. And so we work hand in hand. Amy is a part of not only our incident command and our briefings that occur twice a day, but she's also working with Penny and others at the county health department. So whenever we test someone, whenever we find, we send someone back to the community who tested positive and is no longer contagious or tested negative, all of that is shared, and they know who those patients are and where they're going to. And then Amy and Penny and their team keep us informed about how they reach out to the other health departments around the counties near us in the region as well. So I would say I don't know of another county that's probably better linked to their healthcare provider or to the surrounding county health departments than what our county officials and health department have put into place here in the South Central region. I've never in my 35-year career seen this, and it's serving this county and this region very well.
Question for Brian, again, can you provide an update on testing being done at the IU Pathology Laboratory?
Excuse me, yes. So when we first started last week, our number of tests were, just in the hundreds. And as we've continued to grow, we've been able to test more and more and expand that capability. And that goes back to that phase, that 3 phases of testing, where in the initial phase, we didn't have the ability to test. And so it was all dependent upon the state. The second phase was, going to our IU Health laboratory in Indianapolis. And then the third phase will be, when we start testing community and others support that testing across other testing entities and commercial testing companies. As far as our testing in Indianapolis, that facility has a very quick turnaround time. So we're getting results in less than 24 hours. As part of our IU Health network, no matter where there's an IU Health facility in Indiana, there are many trips, and you probably have all seen our either our Toyota Priuses or other cars on the road with the IU Health label on the side. going all over the state of Indiana, going to our clinics and our hospitals, picking up these samples and picking up the medium that we're testing. So that happens no less than 8 times a day here in Bloomington. We're taking test samples, all test samples, but also these COVID test samples to Indianapolis, to that lab. And then all those are electronically reported to us. And as the second they're reported in Indianapolis on the analyzer, they're released to us to be able to see those. And again, I'll stress the importance of the health department, and with Amy Meek being that shared service between the health department and IU Health, she gets all of that information and has access to that information. So it's a very quick process, and much better than what the other corporate labs are able to turn around. Some of their turnarounds are 3 to 5 days. So that's serving us well to be able to quickly discharge patients and more importantly, give confidence and release some anxiety and reduce anxiety for our patients. When a provider says you may have COVID, because we are learning so much more about this virus, it's not a good thing. It's a very devastating word to hear. And so we're treating it like that and making sure that our patients and their families understand, even if they're negative, what signs and symptoms they should continue to look for. But having that quick turnaround is really alleviating that anxiety in a very quick period of time.
Again, from Emily, regarding the yellow tent outside the hospital, can anyone show up to that tent if they have symptoms? What happens if someone is thought to have symptoms?
Yeah, so there are 2 types of people that will show 2 different tracks. One track is you've called the virtual hub, and that's what we're asking people to do. It's called the Indiana University Health Virtual Hub. They will do a screening, and then they will say, yes, you screen in, you probably should go be tested. We actually get a warm handoff is what we call it. So we get your name and contact information, and when we will expect you to be there. So when you arrive, we're able to test you, and then we log you in. An advanced practice provider, a nurse practitioner or a PA is there, and they will make sure that your other vitals are all okay. If you need to be seen further into the hospital because your symptoms are more severe, we then bring you into the emergency department and you become an emergency department patient. If your symptoms are not severe enough to be in the emergency department, then we provide you education on what you need to do at home, about isolating, those types of things until your test comes back. And if you have tested positive or negative. And then if you haven't contacted the hub, you come into the emergency department just straight up. We immediately put a mask on you. Every patient's given a mask. We screen you the same as the virtual hub does for the same question. And then we would either take you right back to the emergency department, or we would take you to that tent where you could be tested depending on how you screen and are triaged by our providers in the front of the emergency department. And all that is done in the emergency department. We've converted those front rooms to negative air pressure rooms just to be safe.
From Ethan Burks from WFIU, WTIU, and I think this matches largely a question we've received from someone else too. For Brian, how are local hospitals doing on supplies, and has Governor Holcomb's issuing of the National Guard to distribute supplies helped at all?
All supplies help. We monitor really hourly. I have a dashboard on my computer. All of us in Incident Command do. And so we know with our Integrated Service Center in Indianapolis, where all of our supplies come, we know how many to the mask we have on supply and delivered to all of our areas. We do a green, yellow, red every hour, and every day we look at where our most needed supplies are. As you can imagine, masks are our most needed supply because we put those on and off continuously, and now we're using them on patients as well as we learn more about how this virus sheds before you show symptoms. So the community members who are making masks, we are actually using those not only for our employees, but my wife made me one right here that I use when I go out, and I have a supply of those that I can use and then discard. So masks are our most valuable resource, and those go from green to yellow sometimes, depending on our deliveries. So the governor's issuance has been terrific. I will also do a shout out to the school corporation, to IU, Indiana University. There's also some other local businesses who utilize N95 masks and other kinds of masks that have given us their supplies, which has been fantastic. And we're using those supplies as well. So we have what we need. We know we're at least 45 days out in the current usage, but we also know, as we've seen in other communities around the globe and around the state, as we continue to see more patients, we will need more masks. So we're appreciating all that we're getting donated, all that's being given from the national and state stockpile, and any that we can get from businesses.
Okay, do we have any media who want to ask a question here online? I can begin to work through some of our other questions here that we've received on Facebook and elsewhere. So what happens if local factories have a positive employee, but the factory work is deemed essential? Don't know who want to take that one on.
Well, I can tell you what we do if they're a member of our occupational health program. We would put them through the testing process and criteria as we normally do. And then we would make sure that the health department knows about that, and then they would instruct and educate the team there, along with our occupational health professionals. We've done some education to all of those who are part of our occupational health program, where we put nurses inside of local factories, and we've done a great deal of education and training there. But from a business standpoint, I really can't answer that question.
This is John. I would just say, as an employer, we are always monitoring that, and particularly sensitive to a police department or a fire department or waterworks and those, and we have protocols in place in the event that someone is identified. That's not been the case yet. And I know many of our employers are essential, like Cook and Catalent, Baxter, and others. And they, too, I'm sure, have protocols for, first, of course, if you feel sick, don't come to work and check out your symptoms. But if it is identified as somebody, then there'll be protocols to protect both that employee and then others who may have been in contact with them. And for all of us, we have, not only taking care of each employee, but also making sure that we have redundancies and protocols to try to diminish the spread of that, whether it's simple things like our police shifts. We no longer have roll call at the police department, so we don't have police officers sitting in a room together. We don't have, when the two shifts overlap and change, there are significant protocols to protect, and similar with fire department shifts and that kind of thing, to try to protect and isolate any problem that might happen.
We are running close on time. We're going to try to, the Facebook questions we've had come in, we're going to try to answer some of those offline on Facebook. So we will try to get to all those questions afterwards. But I do have one other question that relates a little bit to what I was saying earlier about the breakup of the student party. Is Bloomington Police writing citations for obvious violations of stay-at-home orders, such as student house parties? I don't know if there was a citation issued the other night, but I do know it was broken up.
Yes, I think I know Bloomington Police and IU Police are coordinating very closely on that. Even conversations today about that. The police are intervening. I don't know that we've had to issue a citation to protect public health. Normally, we will respond to these with instructions and counseling and guidance. If there's blatant violations that would continue, then we would issue citations as needed. But I don't think that's had to happen yet, and I hope it won't. But we will continue to work with all the public safety folks to make sure that we protect the public health.
Okay. Well, we're right up at 2 o'clock. Thank you, everybody, for participating, and thank you for your time. We will do this again next Friday. Again, we're planning at 1:15. We'll send out an advisory at least by Friday morning to advise of that with the information to log in. Thanks everyone for your time.
Thank you all. Appreciate it.
Thank you very much. Appreciate it.